Hi, if you're taking anti-seizure medication and you run out of the seizure medication or the pharmacy does not have it anymore, what can you do? There are three solutions for this problem. The first solution is that you can get the same medication with the same active ingredient or the same generic under a different brand. So if you are taking carbamazepine, Tegretol, you can take it under a different brand name and they are all the same. There are some slight differences between them, mostly between 10 to 15%, and that can be monitored with blood levels. And the second solution is that if you don't have the same medication or any generic of this medication, then you can choose a medication that has similar mechanism of action so that you can get the medicine with a similar mechanism of action so that hopefully will work on the same channels and the same receptors. It can help. So for example, if you're taking carbamazepine Tegretol, then you can do, like, for example, phenytoin, because they both work on the sodium channel and they're sodium channel blockers. Or you can take Vimpat, lacosamide. And the other thing, if both of them are not available, then you can do a third option, which is starting an anti-seizure medication that is new, but it has a fast titration and fast reaching to the target dose because the patient is at a high risk of having seizures because they're not taking their medication. And we have about 32 anti-seizure medications to learn about all the mechanisms of action and how we can choose between them. You can see this video for all those details, and stay healthy and see you in the next one. Salam.